the JAMA Network.
Hi, my name is Jennifer Wolf. I'm an Associate Professor of Health Policy and Management at Johns Hopkins Bloomberg School of Public Health with a joint appointment in the Division of Geriatric Medicine and Gerontology in the School of Medicine. We know that older adults with disabilities commonly also have complex medical needs and are heavy users of health services. Coordinating their care is difficult. Most older adults with disabilities live in the community with the help of family and other unpaid caregivers. Although the caregiving role is highly varied, it often involves considerable time and may affect caregivers' own health and well-being. However, we don't know about the experiences of family caregivers who manage care or navigate health system demands because they're not routinely identified or assessed in healthcare delivery. The purpose of this study was to examine how caregiver involvement in healthcare activities relates to the types and the intensity of the caregiving role, use of supportive services, and caregiving-related effects. We examined 2 linked nationally representative surveys that together provide information about the health and sociodemographic characteristics of both older adults with disabilities as well as their family and other unpaid caregivers. We examined 2 highly prevalent and clinically important health management activities. We compared caregivers who provided help with coordination of care between healthcare professionals and medication management, which we defined as substantial healthcare help, with caregivers who did not provide this help. We examined 5 caregiving-related effects, including physical, emotional, and financial difficulty, participation in social and leisure activities that were important to the caregiver, and work productivity loss among caregivers who were working. We had 3 main findings. First, of about 15 million family and other unpaid caregivers who were helping about 8 million older adults with disabilities who lived in the community, we found that about 6.5 million, or 45%, provided substantial healthcare help. 1 in 4 of these caregivers reported their own health to be fair or poor, and about half were helping an older adult with dementia. Second, we found that caregivers who provided substantial healthcare help provided significantly more hours of care than those who did not provide this help, on the order of about 28 hours of care per week. Just 1 in 4 used supportive services, including participation in a support group, respite care, or education or training about how to provide assistance. Third, and most important, we found that caregivers who provided substantial healthcare help were about twice as likely to experience physical, emotional, or financial difficulty compared to caregivers who did not provide this help. And they were more than 5 times as likely to participate less in social or leisure activities that were important to them, such as attending religious services or getting together with family and friends. Rates of employment did not differ. However, work productivity loss was 3 times higher among working caregivers who provided substantial healthcare help compared to caregivers who did not provide this help. Our study establishes that the hard work of managing complex care extends beyond patients and healthcare professionals to family and other unpaid caregivers. We also present the first national estimates of caregiving-related work productivity loss. Our estimates are lower than had previously been reported, but nevertheless indicate that the effects of caregiving extend to employers largely in the form of lower productivity among caregivers who are physically on the job. Effective interventions to support family caregivers now exist, but are largely disconnected from mainstream delivery. The next step is to translate and diffuse these interventions more widely in mainstream delivery of care, as well as to develop new innovations that more purposefully involve family caregivers through such strategies as consumer health information technology and new models of care, such as accountable care organizations.